Here's the place where you will find alternative ways to make you stronger and healthier. Here's a melting pot where acupuncture, functional medicine, biomedicine, herbology, and nutrition are well integrated. Welcome to Acupuncture and Above. Hi there, I have a question here for you today. Have you concerned about your digestion? Have you ever experienced that you're no longer digesting food as fast as before? Do you have bloating?
These are common symptoms that could be related to insufficient stomach acid production.
That's right. As a healthcare professional, we have seen so many patients with these symptoms and a nutritional deficiency that can be traced back to poor gastric acid production. So today, we're going to dive deep into the importance of stomach acid and its role in the digestive process. We made an episode of vitamin B12, which included the explanations of stomach acid. But today, we want to separate this topic out, explore the fascinating world of stomach acid. So Dr. Shao, can you explain to our audience that the role of stomach acid in the digestive process?
Of course, healthy stomach acid, also known as gastric acid, plays a critical role in breaking down the food we eat into smaller particles that can be easily absorbed by the body. It is primarily composed of hydrochloric acid and assists in the digestion of proteins.
How does stomach acid accomplish this?
Well, when you eat food, your stomach releases acid to help break down the proteins in the food. The acid also helps to kill any harmful bacteria or pathogens that may be present in the food. Without enough stomach acid, the food may not be properly broken down and can lead to digestive problems such as indigestion, bloating, and gas. Stomach acid helps to stimulate the release of digestive enzymes, which are necessary for the broken down of carbohydrates, fats, and proteins. The acid creates an optimum pH environment for these enzymes to work effectively.
Absolutely. Maintaining a healthy pH balance in the stomach is critical for overall digestive health and the prevention of various health problems. In addition to aiding in digestion, stomach acid also helps to activate certain hormones and vitamins that are necessary for overall health. Indeed, a healthy level of stomach acid is essential for proper digestion and absorption of nutrients. So Dr. Shao, why does our body produce less stomach acid? What happened?
That is a great question. I think it's a common concern for a lot of people. In fact, we have discussed about it in our last episode about vitamin B12, but I think it's essential for us to mention it again here.
Definitely. So what are the most common factors that lead to the reduction of stomach acid?
Well, age is one of the common factors.
As we age, our bodies naturally produce less stomach acid, which can lead to digestive problems. Unfortunately, it's a part of the aging process.
That's true, but sad. What is the second common factor?
Stress. Chronic stress can lead to a reduction in stomach acid production, and this can happen at any age.
That's also true. What else?
Certain medications such as proton pump inhibitors, PPIs, which is used to treat acid reflux and ulcers, and H.Pylori infection, which is a bacterial infection that can cause inflammation, and some autoimmune conditions such as pernicious anemia, and additionally, certain types of gastric surgery, such as gastric bypass surgery, can all lead to a reduction in stomach acid production as well.
How can we tell if our stomach acid is getting lower?
Well, the symptoms can vary, but some common ones are bloating and increased gas, indigestion and discomfort after meals, as well as fatigue and low energy levels due to malabsorption of nutrients. Low stomach acid can also lead to nutrient deficiencies. Stomach acid helps kill harmful bacteria and pathogens in the stomach. So, there's not enough acid, it can weaken our immune system and increase the risk of infections.
What about heartburn?
Well, When there is not enough stomach acid to break down the food in the stomach, it can lead to the acid reflux and heartburn.
Yes, it is. So thinking about it, when you have a low stomach acid, the food will stay in the stomach for a longer period of time to be digested, right? And this will increase the pressure within the stomach, which force the stomach acid upflow into the esophagus, causing heartburn. In addition, because of the low stomach acid, it can lead to incomplete digestion of food, which can further causing fermentation and the production of gas. And this will also lead to the increase of pressure within the stomach, further causing acid reflux. So here's the common scenario in clinics. When somebody having a heartburn, they normally reach to proton pump inhibitors such as Prozac for quick relief, right? Well, these medications are effective in managing acid reflux and ulcerations by blocking the productions of stomach acid. But long-term using these medications can make the body dependent on the medications in control of the productions of stomach acid, but it decreases the abilities of your own natural ability of producing stomach acid. So what if someone's heartburn or acid reflux is because of low stomach acid at the first place? What happens if they're taking the medications of PPI? They further reduce their stomach acid, right? So they would feeling temporarily better, but once they stop taking the PPI, the acid reflux is getting worse. And they increase the dosage, they're feeling better. Once they stop taking, the stomach acid getting worse. It becomes a negative feedback loop. So what should we do to help them? Treating the root cause. We got to figure out what is the reason that is causing low stomach acid production from the first place. Should we work on stress management? We'll work on the liver, gallbladder, pancreas, intestines, so on and so forth. And then our goal is to encourage, restore, or recover the functions of your natural ability of your stomach to produce stomach acid, to digesting your food efficiently, to reduce the pressure within the stomach, and that way the acid reflux or heartburn will be reduced, right? Now we're going to introduce a simple, free or affordable way to assess your stomach acid condition at home. This is called baking soda test, also known as stomach acid test.
First, make sure you have an empty stomach. It's best to perform the test in the morning before eating or drinking anything. Gather the following items: baking soda, water, a timer, and a paper with a pen to record your result.
Next, measure out a 1/4 teaspoon of baking soda and dissolve the baking soda in the 1/4 or 1/2 cup of water. Stir well to ensure the baking soda is completely dissolved.
Drink the entire mixture of baking soda and water on an empty stomach and write down the time when you take the mixture.
Pay close attention to any sensations or reactions in your body after ingesting the baking soda. Typically, if your stomach acid levels are normal, you may belch or burp within 2 to 3 minutes of ingesting the baking soda. This is because the reaction of baking soda with stomach acid produces carbon dioxide gas, which can cause belching. And normally it's a several belching, rarely just one. If stomach acid levels are low, the reaction may be delayed or reduced, resulting in less or no burping or belching at all. Therefore, if you do not belch within 5 minutes, it may indicate that you have low stomach acid levels. On the other hand, if your stomach acid is high, you may belch or burp around 1 minute.
Write down the time that you have reactions, whether or not you belch. It's recommended to repeat the test on 3 consecutive mornings to get a more accurate assessment of your stomach acid levels.
The reaction between baking soda and the vinegar is similar to the reactions between baking soda and the stomach acid in this test. Both reactions involve acid-base reaction, where baking soda, which is the base, reacts with acid to produce carbon dioxide gas. This reaction produces carbon dioxide gas, which is released as bubbles or fizzing, similar to the burping or belching that may occur during the baking soda test. Alright, at the end, we need to state that the baking soda test is not a definitive medical diagnosis and should not be used as the sole basis for assessing your stomach acid levels.
If you suspect you have issues with your stomach acid levels or digestive health, it's best to ask your doctor for proper evaluation and a comprehensive assessment.
Thank you for watching this episode of Stomach Acid. If you find this information helpful, don't forget to refer to your friends and families, and don't forget to subscribe to our channel. Until next time, stay healthy. Bye.
See you next time.